Hi, I'm Kate, and I'm going to go over how to do a forward-facing carry in a stretchy wrap. First, just a couple quick safety things for forward-facing. You want to always, of course, make sure your baby's airway is clear. You want to make sure they're not getting overstimulated, and this is a narrow-based carry, so you want to make sure that your baby has healthy hips before you do a carry like this. So again, going back to the airway, your baby has to be old enough and strong enough to hold their head up. So if during tummy time they can push up and look side to side without falling down, then they have the strength to hold their head up. If they start to fall asleep, you want to turn them to face inwards, because if they fall fully asleep, they can slump down and close off that airway. So make sure that they are awake and alert. And kind of going along with that, make sure they're not getting overstimulated. Some babies love to see the world, others it's a little too much and they need a break, so go ahead and turn them to face inwards if they need that break. And then finally, if your baby has hip dysplasia or other joint issues, check with your doctor before doing any baby wearing. But if your baby is healthy, then this should be no problem. So, going into the carry, you want to start with your middle marker in your middle. So this is the same as a standard pocket wrap cross carry, sort of the generic one, the carry that most people use with a stretchy. So we'll set up the same way, and I'm going to turn this down just a little. So you start in the middle, and you're going to cross at your back with one side, and come over your shoulder, like that, and then take the other side and cross the other direction, taking care on both sides that you don't get anything twisted back there. You want to keep everything nice and flat so it's comfortable. And you want this to be pretty snug because it's going to stretch over your baby when you go to put them in. Gather your tails and tuck through that center cummerbund. And then you're going to cross the tails, and keep in mind that the cross is where your baby's bottom is going to be. So if you have a shorter baby, you want a higher cross, taller baby a little lower, so that you keep them close enough to kiss when you're finished. So I'll go ahead and cross about there with that cross. Then I'm going to take my tails and just double knot in the back. You can also, instead of knotting here, you could bring them back around to the front and knot in front if you have a lot of extra tails. So I'm going to grab my baby, and I'm going to start with the pass that's closest to my body, and I'm going to put her leg in to that pass. And you want to spread this as far as you can. If this were a standard inward facing carry, you would want to go knee to knee, so you want to get as much knee to knee as you can and kind of have her kind of sitting as much as possible on the wrap. And then you're going to do the other side, the other leg through that. So now she's sitting on that X. Again, spread as much as you possibly can. It's gonna bunch back up, but you want it as bunched as spread as you can. So then you take that cummerbund pass, bring it over her legs, and just secure it around her for a little extra snugness. And there you go. That's all you need to do. To get her out, you take this back down and slide one pass over. Get that leg out. And the other pass, just pull her right out. And you're done. Thank you.